We're concerned that people are dismissing Omicron as mild. Surely, we have learned by now that we underestimate this virus at our peril. "77 countries have now reported cases of Omicron, and the reality is that Omicron is probably in most countries, even if it hasn't been detected yet. We're concerned that people are dismissing Omicron as mild. Surely, we have learned by now that we underestimate this virus at our peril. Even if Omicron does cause less severe disease, the sheer number of cases could once again overwhelm unprepared health systems. Vaccines alone will not get any country out of this crisis. It's not vaccines instead of masks. It's not vaccines instead of distancing. It's not vaccines instead of ventilation or hand hygiene. Do it all. Do it consistently. Do it well. Vaccines are tools that have the greatest impact when they're used to protect those who are most at risk in all countries. Although we expect further improvements in supply, there are no guarantees, and the hard-won gains we have made are fragile. Evolving evidence suggests a small decline in the effectiveness of vaccines against severe disease and death, and a decline in preventing mild disease or infection. The emergence of Omicron has prompted some countries to roll out booster programs for their entire adult populations, even while we lack evidence for the effectiveness of boosters against this variant. WHO is concerned that such programs will repeat the vaccine hoarding we saw this year and exacerbate inequity. It's clear that, as we move forward, boosters could play an important role, especially for those at highest risk of severe disease and death. Let me be very clear. WHO is not against boosters. We are against inequity. Our main concern is to save lives everywhere. Giving boosters to groups at low risk of severe disease or death simply endangers the lives of those at high risk who are still waiting for their primary dose because of supply constraints. On the other hand, giving additional dose to people at high risk can save more lives than giving primary dose to those at low risk. In most countries, those being hospitalized and dying are those who have not been vaccinated. So the priority must be to vaccinate the unvaccinated. It's really quite simple. The priority in every country and globally must be to protect the least protected, not the most protected. There remains a vast gap in rates of vaccination between countries. 41 countries have still not been able to vaccinate 10% of their populations, and 98 countries have not reached 40%. We also see significant inequities between population groups in the same country. If we end inequity, we end the pandemic. If we allow inequity to continue, we allow the pandemic to continue.